طبعا دكتور احمد سهل عليا المهمه شويه بانه شرح البيزكس بتاعت الارتفيشال انتليجنس، فانا هخش على طول في الموضوع وهتكلم على الارتفيشال انتليجنس ان هيباتو جاستروانترولوجي. الحقيقه ان الموضوع بيتطور بشكل كبير جدا وما عدناش يعني قادرين نواكب اللي بيحصل. بريفلي هايلايت الحاجات اللي احنا ممكن نشوفها في الهيباتولوجي والجاستروانترولوجي مع فيو توك هوم مسجز والليميتيشنز زي ما دكتور احمد قال. الابلكيشنز in hepatology over the past decades, the field of hepatology has witnessed major development in diagnostic tools, prognostic models, and treatment options. Though through the artificial intelligence and machine learning, computers are able to learn from complex and diverse clinical data set to solve real-world medical problems with performance that can surpass or exceed the physicians in certain areas. Artificial intelligent algorithms are currently being implemented in liver imaging, interpretation of histology, non-invasive testing, and also prediction models for disease severity and prognosis. Most artificial intelligence-based algorithms are still considered in early development, and their utility and impact on patient outcome still need to be assessed in future larger scales and inclusive studies. The use of AI in hepatology will enhance physicians' performance, will decrease the burden and time spent to documentation, and reestablish the personalized patient-physician relationship that is of utmost importance for obtaining good outcomes. Here we see a CT scan that we can measure the fat by the usual technique in the right side, which is minus 13 HU, but on the right side, you look at the automated measurement of the whole fat in the liver using the artificial intelligence technology. So there is a big difference in evaluation in a small area or a specific area of interest rather than evaluating the whole liver. This is another example when you see image A, there is a liver abscess in segment 4 and segment 8, which is detected by the artificial intelligence with this box. The same like Dr. Ahmed Murad showed us for detection of the polyps. Here in image B, this shows a larger tumor located in segment 4 with slight pushing of the margins of S8. So the artificial intelligence can classify the liver loops, and it can measure the lesions, and it can detect the lesion, and it can also characterize the nature of the lesion inside the liver, as you see, with different color stages. Here an example of seeing or interpreting the liver biopsy. Here it is a slide of the liver biopsy. Here is an area of interest that is magnified, and then this goes through convolutional neural networks that also eventually give us a map for the areas of fibrosis, and then classifies this biopsy by having fibrosis of 0 to 4, ballooning, inflammation, steatosis. It is more accurate than the human eye if we use it for biopsies. Here is a more complicated algorithm, or more complicated example, where there are several different pathologies, ballooning, inflammation, steatosis, and the artificial intelligence can stain this with a special color or special image format, and then interpret it at the end as a quantitative measure of the underlying pathology in the liver. Here also another example where you can convert the pathology into a color scale which is red is the most advanced one, which is fibrosis, and then around it different stages of inflammation or inflammatory cells. This makes it easier and clearer for physicians and for histopathologists to interpret and to draw a map for assessment, for example, for liver fibrosis or inflammation or balloon. These are the areas of use where we can use artificial intelligence applications in imaging of the hepatology of the liver, or in histopathological evaluation, or in identifying the risk of the patients, if there is high risk patient or low risk patient, using different non-invasive markers, and also we can predict the outcome of cirrhotic patients and the prognosis. So this was the first part of the artificial intelligence in hepatology. I will move to the application in gastroenterology, which is a diverse application in all parts of the gastrointestinal tract. But I will spot some of the most important things. For example, in the upper GI, we can benefit of artificial intelligence in automated detection of esophageal dysplasia, in early esophageal or gastric cancer detection, to assess the cancer invasion, or to detect Helicobacter pylori, or to diagnose subepithelial lesions, and many other applications in the upper GI. Here is an example where they used computer-aided detection of early neoplastic lesions in patients with Barrett esophagus. They used 100 images from 44 patients with Barrett esophagus and used the computer algorithm to specifically draw a color or a specific texture or a margin for the lesions and to detect the early neoplastic Barrett lesions. The results of this study showed that the system identified early neoplastic lesions on pre-image analysis with sensitivity and specificity of 0.83, which is considered good or excellent one. At the patient level, the system achieved a sensitivity and specificity of 0.86 and 0.87 respectively. Here, you see the computer system can delineate the areas of advanced neoplasia in patients with Barrett esophagus. So they concluded that the automated computer algorithm developed in this study was able to identify neoplastic lesions with reasonable accuracy, suggesting that automated detection of early neoplasia in Barrett esophagus is feasible. Here is another example where the computer detects areas of inflammation. Here is the normal stomach, so it appears all blue with small areas of inflammation here. As long as the inflammation increases and the atrophy increases, the colors changes from the blue to the light blue to the yellow to the red color where there is intense inflammation and Helicobacter may be present in these areas. So this may also guard the biopsy for the Sydney protocol or outside the Sydney protocol to detect early dysplasia or presence of Helicobacter pylori. Here is another example, which is Inception V3. This is a deep learning model to classify the images as correct or failure in catheter position during doing manometry, and also the exact class of integrated relaxation pressure in manometry. When you look at the biliopancreatic, Dr. Ahmed covered some of it, but I will just focus on the cholangioscopy. I will not mention the ES. Here is an example where the cholangioscope can identify the nature of the strictures inside the bile duct, and with good sensitivity, positive predictive value and accuracy up to 94% in each. Also there are some applications of the small bowel. You can use a small bowel capsule endoscopy, artificial intelligence models to automatically detect the lesions or detect the bowel cleanliness or compartmentalizing the small bowel. You can use artificial intelligence to tell you if you are in the duodenum or in the jejunum or in the ileum, etc. And it also can decrease the time for reading the capsule endoscopy and increase the accuracy. Here is an example of artificial intelligence where the capsule can detect the lesion and can measure it. And here also a more obvious model. This lesion can be missed easily. If you are seeing a very long video for a capsule endoscopy, you can miss this easily. But the lesion, the artificial intelligence can detect here the ulcer and spot it, and makes the machine stops at this area, so you will detect it. In lower GI endoscopy, the applications are too many. In the lower GI, Dr. Ahmed also explained some of it, where we can detect the polyps or characterize even the polyp, but there are also more data generated in terms of size of the polyp and the presence of polyps in the proximal part or the distal part. The artificial intelligence or the computer assisted devices can overcome or can surpass the normal human eyes. Here an example also of the deep learning colonoscopy. It can detect the polyp here, and it can also tell you if it is pedunculated or no. Look at this, and here it can detect the mass and say that it is lipoma with a certainty of 97.6%. or you can here detect that this is a tool and this is a sessile polyp, etc. Here also it can draw colors for the good prepared areas, for the bad prepared areas, for the light reflection, so you can easily evaluate your patients, and the quality indicators you can measure it. Also, it can characterize the lesions and give you an idea about the stage of the cancers, or if it is possibly to be invasive or not. There are a lot of limitations of artificial intelligence that we have to be aware of. Number one is the applicability in routine clinical practice is not widely adopted, and there is lack of validation and issue of insurance. The reimbursement is very important in the Western countries, so if the tool is not FDA approved, so they may not reimburse the cost of the endoscope you do using artificial intelligence. If there is over reliance on artificial intelligence, this may lead to the skilling of the endoscopist. So also, if you have biased data sets generated from different countries, you may not able to apply this in your country. Also, the endoscopist diagnoses can be affected by the incorrect artificial intelligence prediction models. There are lack of data collection from different countries, and we need to generate our own data and to generate our own morphology, our own polyp, and etc. And also there are differences in endoscopic technology. There are a lot of manufacturers and they are not the same. So we have to standardize everything before we rely on artificial intelligence in endoscopy. And we have to do also an international validation on a global scale. So my take-home message is artificial intelligence is a rapidly growing discipline that has the potential to revolutionize the field of gastrointestinal endoscopy. It's technology that would compensate for human limited capability and prevent human errors and increase worker productivity and efficiency. Artificial intelligence is a fast and reliable assistant to treat the continuously growing number of patients. It offers the ability to improve diagnostic accuracy and uncover new disease associations, identify the risk of individuals, and guide therapeutic decisions making. Continued exploration of possible applications are expected to accelerate and to drive towards precision medicine, and certain limitations are still present that needs to be solved by further research. And thank you.